You take the embryo transfer and then you wait for 14-15 days, take the luteal support medications, and then you get the beta HCT test done, and then you come to know it is negative. So this result is actually very disheartening, disappointing, depressing for not only the patient but also for the doctor. So now you would from your end think that, did I do something wrong? Did I not eat well? Did I not take enough rest? Because of climbing up stairs, did this not work? Because I went through and did all my routine work, did this impact? What was that which impacted my result? So you will have so many thoughts crossing your mind, but then this is not it cannot be explained like this. There is a scientific reason behind why pregnancy does not get implanted, the embryo does not get implanted. So today I'm going to dive a little deeper into what are the different reasons, causes for embryo not implanting into the endometrium. So hey, hi, I'm Dr. Indu from Fertility Urology Center, and I'm going to be delving into why embryos do not implant after the embryo transfer. So coming to the different causes of why after embryo transfer the embryo is not getting implanted. So now if I have to list down what are the different reasons of of embryos not getting attached to the lining of the uterus, then the most commonest reason number one is the embryo itself. Number two, it can be the uterine lining or the endometrium related issues. Number three is the other associated reproductive issues that a woman might be having, like endometriosis, adenomyosis, or any other infection. Then you have fourth is the immunological reasons that might be playing a role in embryos not implanting well. And number five is it can be unexplained. Everything is perfect, everything is fine, and still embryos is not getting attached. So these are the various reasons. Then not to forget that if the embryo transfer is not done on the right time, then that is also one of the reason why embryo may not implant in the endometrium. So coming to the details of every causes that I just enlisted. So let me describe that in detail. Coming to the second cause, that is the uterine factor. When I say uterine factor, generally before you start your IVF cycle, the fertility expert will definitely ensure that the lining is all good and it is triple lined, three layered, thickness is adequate, minimum 7 to 8 millimeters is what is needed, and then the blood flow studies is all done, and that is ensured. Now, despite having all these factors in place, still the embryos are not implanting. So, do we have an answer for this? Yes, there is one more test that can be done to understand whether the endometrium is receptive or not. So this particular test is called as endometrial receptivity array. This test actually understands about various molecules that are there are so many different molecules that play a very important role when the embryo is getting implanted. So these molecules are generally studied for its, some molecules have to be upregulated, some molecules have to be downregulated. We need not go into the molecular details, but this particular test of endometrial receptivity array is something which checks upon whether this receptivity is in sync with the embryo transfer, whether the day that the embryo is transferred is it the right day or not. So this test is offered for those women where your embryo is not implanting despite having the beautiful embryo, the beautiful endometrial lining, and embryo is not implanting. So do you take this test soon after, or one embryo transfer has not worked and you want to take this test? Actually, again, the rule is that if you've had two or three good embryos not implanting despite having a beautiful lining, then you go for endometrial receptivity array. So coming to the third factor that might be impacting the implantation is if you have associated uterine abnormality. Now, when I say uterine abnormality, suppose you have thickening of the wall of the uterus, we call it as adenomyosis, or if you are having endometriosis in your ovaries and it is really of moderate to severe degree in nature, then these may be the factor that might be impacting the implantation process of the embryo. Now, if the uterine wall is thickened or you have endometriosis, then the protocol that is given for embryo transfer is a little different. So one has to also understand and rule out these issues beforehand before beginning your IVF journey, because anything related to the uterine musculature abnormality, or if there is abnormality in the ovaries, such as endometriosis, then this is going to create an environment that is not very conducive for the embryo to get implanted. And that environment basically has to be suppressed by giving you a different kind of a protocol and then taking the embryo transfer. So this is very, very essential. Now, apart from these two things, there are few more uterine conditions which can impact the implantation process. Now, suppose if you're having some kind of a small polyp which might have got missed on the scan, so maybe doing a hysteroscopy and understanding and ruling out that the cavity is all normal and it has not got any kind of abnormality inside. So that is one. Polyp is nothing but a small growth inside the cavity of the uterus. The other condition that can impact the implantation process is if there are subtle, adhesions. We call it as adhesions. They are like barriers, thin screens, which might have occurred because of the infection that has happened in the past. Now, this again can be missed or can get missed during the scan, that regular scan that is done for assessing the endometrial lining. So for this also, hysteroscopy is the answer. And in hysteroscopy, one understands if there is any barrier, if there is any screens or adhesions inside which needs to be removed, and then it will enhance the chance of pregnancy. So the other condition is if suppose you have a uterus which is a little abnormal, in the sense some kind of a uterine anomaly is found, then that has to be again dealt with. And this is all done even before you begin your embryo transfer procedure or the IVF journey as such. So these are few of the conditions that might have an impact on the process of implantation. So as I said, the protocols are something that you have to consider when you have endometriosis or adenomyosis. Then the protocol will definitely be different, and that should be utilized to enhance your chances of pregnancy. Or if one or two cycles of embryo transfer have not worked, then you going through a hysteroscopic procedure to evaluate the cavity within and to rule out that there are no polyps, there are no adhesions, and the endometrium or the cavity lining looks all normal. This is something that needs to be confirmed by doing a hysteroscopy. So the fourth reason can be the immunological reason, the immunological system, which is not favoring or not allowing the embryo to get implanted. And this is sometimes possible. And to tackle this, there are few medications that are given, there are few tests that are conducted, and this will be definitely told to you by the reproductive specialist about how to go ahead with this. Now, these particular tests to understand about the immune status will be done only if few transfers have not worked, and only then you become eligible to get this test done. And definitely not when one embryo transfer has happened and that has not worked, and then you need not go through a lot of intensive tests at this after one transfer itself. Now, the other immunological reasons would be, I'm sure the other parameters such as your thyroid, your sugar level tests are dealt with, or your obesity issue is also tackled with. Because if your thyroid is not correct or not right, then this might also impact your implantation. If your prolactin levels are not checked, and if they are certainly abnormal, then this might also have an impact on the implantation. And also, if someone who is having sugar, but then they are managing and it is under control, but ensure that this is kind of under good control before you start the journey of IVF, start the process of embryo transfer, which is very, very essential. Another uterine abnormality which I had to mention in the previous reasons was if you are having fibroid uterus. I did mention about endometriosis, adenomyosis, but then there is another condition called fibroid. Fibroids are nothing but the muscular overgrowth of the musculature, and this appears like a ball. It can be inside the cavity, it can be in the muscle itself, or it can be on the top. So, if you are someone who is having fibroids, multiple fibroids, but then none are coming in the uterine cavity, then yes, you can go ahead with the transfer. But suppose you have taken the transfer, it is not working, then you have to get these fibroids. If they're really big in size and they are kind of in the musculature or it's on the surface, but they are bigger in size, then the decision to remove those fibroids would also be taken. So this is something that has to be discussed with your doctor before you take the next procedure of embryo transfer. Very, very important. Now, other than the uterine factor, I want to also insist about your overall health. That is, if you are someone who is on the heavier side or you are overweight or obese, when I say overweight or obese, overweight is something when your BMI is somewhere between 25 to 30. Your BMI calculation, it falls in this range. And if your BMI is crossing 30, then we call it as obesity. And if the BMI number is more than 35, then it is morbid obesity. So there have been studies which says that as the woman's weight increases, it might have an impact on the overall implantation and overall fertility. So even taking this action of reducing weight by 5 to 10%, it will really definitely enhance your chances of implantation. So take note of it. Now, other associated medical conditions also needs to be dealt with a lot of detailing and attention. Suppose you are having BP, you are having sugar, do not take this light, and make sure that this is controlled and it's in really very good control before embarking on this fertility treatment. Now, these are few of the medical conditions that you have to understand. The other factor would be if you are someone who has the habit of having lot of coffee or tea, or if you are someone who is having the history of smoking or alcohol consumption, then even these factors are something that are not going to favor the process of implantation, because all these are creating an environment which is not really very conducive for embryo to get facilitated into the process of embedding into the uterine lining. So even these things are really essential to take note of and take really prompt action to enhance your desired outcome that you're looking for. Coming to the last reason of the why how the embryos may fail to implant. Now, when you're taking the transfer of embryos, what is really very important is the protocols that you are going through to get the endometrium ready. Now, to prepare the lining of the uterus, there are few protocols that are followed. The common is the hormone replacement therapy, where estrogen hormone is given for 10 to 12 days to 15 days. You are monitored by scan to check the thickness of the endometrium, and then progesterone tablets are started, and the embryo transfer happens on 6th day of the progesterone medication. Now, here it is very essential that the transfer is done on the day the doctor has decided. Suppose you have forgotten or you have missed starting that progesterone tablet on the right day, and you, with the fear, you start on the next day and you don't tell this to the doctor, then you will be jeopardizing your results of pregnancy. So please make sure that you are expressing this or telling about this mistake that has happened of not starting the hormone on time. It's okay to cancel that cycle and take another monitoring, another cycle, and then take the embryo transfer. So this is very, very important that you have to do. Now, one more protocol that is commonly done these days is the natural cycle monitoring. Natural cycle monitoring is a very, what shall I say, it's an intense monitoring that is done after a certain days, maybe day 8, day 9. There is everyday blood test that happens. You are called for scans more often, and the doctor will be guided by how your blood test results tell or how your scan picture is looking like. And here again, in the natural cycle monitoring, sometimes you do not get the desired pattern of the hormone that the doctor is looking for, and it might result into a cancellation. So a cancelled cycle is all right, because the right level of hormone that has to be seen on the monitoring is very, very must, because doing the transfer on the right day is extremely essential. So these are few of the things that if is missed or mistake happens, then This should be addressed, or this should be brought to the notice of the doctor, and taken right decisions. This is very essential to be done. So these were the various reasons of why embryos may not implant into the uterine cavity. I hope you get this clarity on seeing all these different reasons. And if you are resonating with this, or if you are having any doubts on this, definitely you can leave a message, drop a message. I shall be happy to answer. But then, what I would like to tell you is that before you start the journey of this IVF treatment, or if you have embryos and you are yet to take it, then do remember to go through the checklist of all these factors and see if you can bring in that corrective action. Because if you do not do anything, you don't take any action, then the result that you are going to expect in the next transfer is going to be the same. So please make sure that the steps are taken, and you are acting upon few of the things that are in your control, and then you go ahead with this process of FET, that is a frozen embryo transfer, or a fresh cycle and a fresh embryo transfer. So if you have liked this video, then please do share it with someone who may be needing this information, and do subscribe this channel if you want to know more on the fertility topics. So I'm signing off, Dr. Indu. See you. Bye.